Hello, everybody. My name is Libby. It's been nice having this class with you this semester. I just want to warn you in advance I have cats, and they will be probably raining on our parade. So let's get started. Streptococcus pneumonia. It's in the domain of bacteria, and you can see right here its taxonomy. Um, yep. It is responsible for, that's a little bit strange, the wording there, the pathogen responsible for infection is cocci. It doesn't have flagella. It uses pili, which attach its DNA. It is encapsulated, so it's gram positive. And let's see, it doesn't form endospores. Um, okay, you can read a bunch more information there. The disease process, it secretes IgA1 protease, which interferes with the host defense at the mucosal surfaces. So what it does is it attaches its little pili, and then it injects its DNA, and then it creates pneumocylin, pneumococcal surface protein A, autolysins, and then all of those play a role in the host's immune system responding to the bacteria. So, of course, like all of our pathogens, pretty much, the big problems that you get are from the immune system. The little pathogen in itself isn't bad. It's the way our bodies respond to it. Yeah, its portal of entry is all over because basically anywhere it can get in, it can cause infection if it's in a non-sterile environment. So, like, it can live in our pharynx and it can live in our mouths, it can live in our nares. But if it gets into a place that's normally sterile, like our lungs or like the underneath our skin cutaneously, then it'll cause an infection because it's not supposed to be there. Also, it can enter the bloodstream. When it does that, it becomes a sepsis, a septic infection, and it can cause meningitis, which is a very bad thing. You don't want it. Um, okay, it causes lots of different infections dependent upon its portal of entry. So we went over that already. It is a big problem for a lot of people in the lungs. That's where a lot of people get infected with pneumonia. I mean, everybody's heard of it. The disease is called pneumonia, and the pathogen is called pneumonia. So it's named there. It's very famous. So basically the lungs will fill up with fluid and it causes like all the symptoms of impaired gas exchange. It can cause collapse, shunting, all the stuff that you don't want. And then this is just an example of infected tissue pictures. That's lung tissue. And then this is a lung on x-ray that has pneumonia, and you can see, oh, look, there he is. Good boy. You can see that it's very dense and difficult to see through, which is not what you want to visualize on a lung. And then also, it can enter through like nosocomial methods. Say you have a surgical site or something like that, you're having a procedure, and it could come in on some of the equipment that is supposed to be sterilized. That's why precautions are so important. Methods of transmission. So it is transmitted via droplet. That, of course, can aerosolize. And then, yeah, it can come out in fomites. It can be communicated to a vector where you could then pick up that vector and you could get infected. This happens a lot at preschools. Preschools, that's why a lot of parents are like, oh my gosh, my kid's been sick the whole time. Or when you become a new nurse, or whenever you do anything like that, your immune system's not used to it yet. And so you get these vectors and you end up getting all these infections. So, yeah, so susceptible individuals, home and living in communities. So, like elderly people and children, they have to really watch out for it. Or people that have contact with them, we need to be very careful and take responsibility for washing our hands. Hello, kitty. That's another kitty. So, testing, diagnostic, detection, and methods. To test and find out if you have it, you're going to use a PCA test, which we're all familiar with from COVID, or a nucleic acid test. Detection and differentiation. Because there are so many different kinds of pneumonia, you want to differentiate which one you have. So you do extra steps. You know how we looked at all those different things where it's like the protocols of like you answer yes, no. It's like a choose your own adventure. What's the bacteria? Well, the last step in that is going to be bile testing, and that's to differentiate it from other newer forms of streptococcal infections. The disease is prevalent everywhere, but some places have a much worse problem with it. And this is usually because they don't have the sanitation that we have, and they're not able to adequately respond to the infection. They don't have the vaccines that we have. And places like Gambia, the colonization rate on infants is 100%, whereas here it's only like on infants it's like 30%. And actually, we're really careful about that in mom and baby. We have to learn about that. I'm sure if you're in nursing school right now, you know that we have to be very, very cautious for these infections. Okay, so this is a picture from the Bill and Melinda Gates Foundation, and I only found one from 2016. So I'm sure this information is incredibly out of date since it's like pretty old. But so this is a mortality rate, and you can see it's in the thousands, and you can see that in the United States in 2016 is 0 to 4, and then all the way up until in Africa, I don't see any in red, but 500, you can see all these little places in the world that suffer much more with lower respiratory infections. This is a map of deaths from lower respiratory infections. So basically, we don't have as many deaths as other people. We don't suffer like other people do from this. Treatment for pneumonia, streptococcus pneumonia, is going to be antibiotics. Prevention, we have vaccines, and then of course, always wash your hands. Okay, so hold on. I have something. These are the interesting facts. I had to write them down and I didn't want to put it all in there. Interesting facts. Okay, you can reduce your chance of getting pneumonia by getting a flu shot. So those flu shots help reduce your risk of, having infection and then having that turn into pneumonia. Everybody's at risk for pneumonia. You don't have to be immunocompromised. If you have like a cut and it gets in there and it's not sanitized, or it doesn't have antiseptic or whatever, you don't have that, and it gets infected, like anybody can get it. There are more than 30 different causes of pneumonia. Lots of different bacteria cause the infection, pneumonia in the lungs. However, there are not more than 30 different causes of streptococcal pneumonia. There's just streptococcal pneumonia. So maybe I should say more than 30 different places. There's just a lot of that one probably isn't accurate. Okay. you could die. That one is accurate. It can be deadly. You could get sepsis, like we talked about. You could have a blood clot in your lungs, a pulmonary embolism. There's all kinds of different problems you can have. You could potentially lose a leg or something. And then good health habits. So, of course, taking care of your health will always help you fight infections. So, that's just like following the healthy plate and making sure that you exercise and drink lots of water, and you'll be better if a pathogen comes along. These are my citations. Okay, thank you so much and have a great day.